Right. Hello, everyone. I got you out of that. Hello, everyone, and welcome to the latest ARCFEST, which also includes the formal launch of Phase 2 of the Applied Research Collaboration North West Coast, which started on the 1st of April, nothing to do with April Fool's Day, and extends until the end of March 2031, by which time I will be in a bath chair. My name is Professor Mark Gabbay, and I'm the Director of the ARC North West Coast, and I'm joined on stage by our ARC's co-director, Professor Ben Barr. Say hello, Ben.
Hi everyone, I'm Ben Barr, the co-director, as Mark said.
So a big welcome to you all. I'm going off script, which Darren's going to be really annoyed about. Both to those of you in the room and those of you who are joining us online, and I understand there's about 100 people in each part of the conference, online and face-to-face. So there are some housekeeping rules for those of you who are here today, which I put under this sheet. I did prepare. So, first of all, if you've parked in the car park, you need the right app and you need to put the code number in. And if you don't know what I'm talking about, somebody at the desk, if there's anybody still there, will tell you. But there's... It was when I did it. Oh, you've done it that way, have you? Okay, well, I did it. I was prepared, you see. I put the app on a few days ago. Oh, well. Sorry about that. Welcome to Blackpool Football Club. It's a pleasure to be hosting you here today. I'm going to run through a few housekeeping points. Don't know why we're starting with the smokers and vapors, but if you are going to smoke or vape, you need to go outside the main reception in the designated area. Apparently, they're located around the palm trees as you exit. And if anyone from public health sees you smoking or vaping, you just need to keep walking because they won't let you back in. If the weather's poor, which it isn't, you're welcome to enter the shelter, so we won't need to talk about that. I hope there are no planned fire drills today. Smokers, take note. If the fire alarm does sound, please remain calm, as of course you would, and make your way down the main stairwell via reception to the fire assembly point across the cobbled area. There's an accessibility needs point. Someone will take you through this Matthews suite and take you out using the evacuation chair. If for any reason the main route's not accessible, we'll use the fire escape to the left of the stage over there and exit out through that pod. And the team will be here from the venue to guide you should you need any help. I'm sure these won't be needed, but always important to mention. So there are no fire alarms planned, and good luck with the parking app. And as has been said, there was somebody at the car park, but if they've gone and you need any help, please do ask. So for those of you who have joined us online, the meeting is being recorded, but please do keep your camera on to ensure that all the sessions feel inclusive, especially during the theme discussions, so that you can see each other. It's much better looking at faces than looking at blank screens. I don't know why I'm looking at the TV screen, because the camera's over there. Can I ask everyone online to stay on mute to avoid disruption unless you want to speak, of course? Please do use the chat function for questions and answers during sessions. If your comment isn't answered for any reason today, we will take the details and one of the team will get back to you as soon as we find the answer. We're trying to make the day as interactive as possible for those online as well as those in the room, so you will be asked questions and asked to participate in surveys as the day progresses. Next slide. We've switched two of the sessions round this afternoon as we wanted to ensure the opportunities from our capacity building programme, including internships and PhD students, and the knowledge mobilisation session were available to everyone at the end of the day after the themes have met. So we've done that moving around to put that through at the end. And please do try and stay to the end if you can. Don't want it to look like Blackpool are losing and they want to get to the car park before full time. Those online, because of course Blackpool never lose, I need to point that out. Those online will have the option to select from the sessions as laid out, and this is now the lineup for this afternoon, but please do, if you can, follow the sessions you originally registered for, if at all possible. You'll have noticed the tables at the back, and this is really important. This is the marketplace. This is where you'll find out about what we're planning to do and what we're doing. So please do visit these stalls. People have put work in to produce the posters, produce the displays, and to tell you about what they're going to be doing. So that's for the people who are here. I'm afraid we haven't got the equivalent, I don't think, online. So, next slide. We're one of only 10 regional ARCs who've been allocated a share of 157 million over the 5 years. The Pan-London ARC competition will be announced probably sometime in early June, but there are 2 areas of the country which don't have a designated ARC, but the ARC is national and will cover the whole country. So between us, the ARCs will cover the whole of England. And that national connection and that cross-ARC working is something that will particularly distinguish phase 2 of the ARC, which is quite different from phase 1. We did do national collaboration, but it's very much an expectation. We had our induction a couple of weeks ago. It was made very clear they expect more national work, more big projects, more implementation at scale to make that change and demonstrate that change that we can make to health and care across the country. We have our partners, our advisors, who are now called public contributors, and staff located right across the region, as you can see on this map, stretching from the very north to the very south of our region. Next slide, please. The aim of today is to introduce you to our themes and work streams who will lead and coordinate the delivery of our aims and objectives as stated in the bid to the National Institute for Health and Care Research, who, as you know, are the funders of this ARC. But we want your input and views, and to take the chance today to discover more about us and work out how you can collaborate with us moving forward. You will hear from our teams who are just starting out on their 5-year journey, and it's your chance to contribute to their plans. There are 5 research themes plus 2 cross-cutting themes and our 4 work streams, and they'll all be working together to drive forward the national and regional prioritised research and outputs that are being planned at the moment, and also to support their implementation both regionally and nationally. Next slide, please. We will be more ambitious in phase 2, and we have to be, as new government targets have been woven into the ARC contracts as part of the new agreements. This will require us to work more closely with industry than we have in the past, and consider how we're contributing towards economic growth and ensure our work is making a real impact in the key areas of supporting government health and care plans, including the 10-year health plan, life sciences sector plan, health and growth missions, and by addressing critical UK health and social care challenges regionally, whilst ensuring they can be scaled up to deliver national change. Next slide. The 10-year health plan will deliver these 3 big shifts into how the NHS works. From hospital to community, from analogue to digital, and from sickness to prevention. And you might notice that the way our themes are put together really does address those different areas of expectation. So our outputs need to reflect this shift in service delivery and aid the transformation of the way the NHS works. This is not negotiable. This is what we are here to do. This is what we're funded to do. Next slide, please. These are the 5 big bets, as the government calls them, which are placed on us. And the ARCs between us will need to find evidence from our work that contributes to these concepts at both local and national delivery levels. Partnership working within the NIHR infrastructure. There's an expectation that all of the elements of NIHR infrastructures work more closely together. The trials groups, the research support service, the biomedical research centres, the ARCs, we're all expected to interdigitate much more than we have done in the past. And there'll be much more coming out of central government, department and NIHR over the next few months about that. ARC at the head of this, as we always are, because we've been set up at the beginning of this new direction in the journey. Data to deliver impact, AI to drive productivity, wearables to make care real-time, genomics and predictive analysis, robotics to support precision. These are the areas of technology and innovation that the government thinks will make the biggest step change differences to the way that health and care works in the future. And ARC can help show what works, what doesn't, how to make it work better. All of this, of course, is underpinned by patient and public input that helps us boost the capacity of our regional workforce, which we also do, of course, in the ARC, to create that research culture which become even more embedded and act as enablers for these areas to arrive in frontline service delivery at pace. Partnership working with other elements of the infrastructure I've already talked about and with other research initiatives and utilising the expertise of the staff across those different organisations, the partners and the contributors, the public contributors, that's the only way we can really do this effectively and efficiently and really make a difference that's relevant to our populations. Next slide, please. I've said this many times before, but today is about understanding that you, online, in the room, and those of us who couldn't make it, are the ARC collectively. It's not Ben, it's not me, it's not a few academics, it's us. This is the whole point of ARCs. This is our ABC, the basics. You collaborate with us and make things happen. We're not the doers here, just presenting work to you. All of us are bringing something unique to the table to get things moving and making a difference. That's important to remember. Next slide, please. Today is also designed to share what we've achieved in ARC Phase 1. And I'd encourage you to look at the evidence that we're bringing from the first phase of the ARC, because a number of the projects in here will be part of our implementation programme as we go forward. Can I ask you all, especially those practitioner champions from our partner organisations, to browse this document and identify projects which could potentially be developed further, implemented or scaled up to make an impact within your organisations or those that you work with. That's the key word we must communicate to all, our impact. As ARC develops, we will work with you on any nominated projects from this booklet and, resource permitting, build on the investment made to date in new research work, which has an overall goal of identifying and reducing the health inequalities faced by both individuals and communities. This is where we sit in the local mix of what our offer to those areas are. There will be a national browsable list of the projects that ARCs have done and are doing, but that isn't ready yet. But as you know, next slide please, from yesterday's news, and you probably knew it already, health inequalities are increasing. They're unfair and unjust differences in health between groups, populations or individuals that arise from the unequal distribution of social, environmental and economic conditions. These determine the chances of people getting ill, their ability to prevent illness, to recover, and the opportunities to act and access health care and social care when ill health occurs. They've been increasing with austerity. We have the tools to bring to the table from ARC Phase 1, however, which can help us and keep that guiding principle laser-like as we progress to 2031. You will hear terms such as for equity, equity mainstreaming, and public involvement. Some of you will be hearing that for the first time. Others are more familiar with it. And it's that experience which needs to be shared across the collaboration and come together on days like today. We also have tools such as our PLDR, which Ben and his team developed, and toolkits for local authorities, and our races library, which Andy in the room and his team have helped put together with colleagues from a number of organisations over the past few years. We've got our publications, our dementia innovations, evaluation data on services, and lots more. So please do look at our website and chat to people today at these tables and find out what we've been doing. Next slide. Here we are in Blackpool, which has the lowest life expectancy in England for both men and women, a result of the combination of poor quality housing, low educational attainment, and poor economic opportunities. All of these factors contribute to increased demand for healthcare, whilst creating challenges for the population's access to that healthcare. These are the types of challenges mirrored across the region, which we must keep at the forefront of our minds as we invest our resources and time carefully and proactively. And that is all part of what we need to demonstrate and provide, and it's what we'll be judged on in our contract with NIHR. Next slide. Thank you for listening, and now over to Ben.
Thanks, Mark. So yeah, we've heard from Mark some of the health challenges that are facing places like Blackpool, and some of you may have seen the report on healthy life expectancy that came out yesterday, showing that a child born in Blackpool could expect to live for 18 fewer years in good health compared to a child born in Richmond in London. But what's most concerning is that things are going backwards, that we've, since 2012, had healthy life expectancy has declined by 2 years, putting the UK, only the US has fewer years of people in good health. So the ARC isn't going to solve that problem, but it can be part of the solution. And to do that, as Mark has said, we have to have a focus on impact on all stages of our work. So that means going bigger, better, and faster, developing bigger projects that bring together collaborations across the ARCs and across the UK, mobilizing that knowledge for large-scale implementation. Next slide, please. So impact, that is one of the 4 I's that organizing themes for the NIHR. As well as that, we need a focus on inclusion. That's something that we've led the way with in the ARC and the Clark before that in the Northwest, developing our health impact assessment tool and working with underserved communities. Innovation. So we're living in a new world where there's this surge in technological development. AI is everywhere, but we need to ensure that that is benefiting people living in places like Blackpool. Investment. To paraphrase Bill Clinton's campaign in the 1990s, it's the economy, stupid. Economic growth is at the heart of the nation's health, at least the right kind of economic growth is. We need to be making sure that we're using the NIHR investment to not only promote health, but also promote economic growth. Next slide, please. So we've had the 3 big shifts, the 5 big bets, the 4 I's, and this is the 7 areas of strategic focus. It's like a strange 12 days of Christmas. But it highlights a couple of areas where we need to focus and some of the challenges. The health system hasn't really recovered fully from the pandemic, so supporting that recovery is going to be key to what we do. And that means building capacity beyond the NHS, building capacity in public health and social care in particular, and focusing on underserved regions, communities that have the major health needs. Next slide, please. So we're going to hear from all of our themes today. We've got multiple programs of work that are being developed by those themes. And we ask you all to get involved in bringing forward your ideas for research and implementation that align with local and national priorities for the health and care systems. And we'll work with you to develop those projects and work with them through to implementation and impact. And there's going to be multiple opportunities. We have 3 ARCFESTs a year, some of them hybrid and some of them in person, and multiple workshops with each of the themes for you to get involved in developing that work. And together we can bring together the collaborations that are needed to drive forward that research and implementation that can make a difference in Blackpool and other places like it. Thank you very much. So looking forward to working with you all. It's going to be exciting progress. And back to you, Mark, for introducing Jim.
Yes, thank you. You really kept to time there, Ben, much better than me. Thank you, Ben. You can always email us after the ARCFEST at one of the emails on here with any queries, and we will get back to you. We welcome feedback and hopefully constructive comments so we can respond to the needs of the collaboration as a whole. It's a long day today, and things may pop into your head on the journey home or afterwards. And please do get in touch and visit our website, which is obviously work in progress, which will be key for us moving forward as our themes build up their papers and their pages and their information about meetings, about proposed projects, about projects ripe for implementation, and all of the things that we're doing to keep you informed of our progress and our projects. So we will have a lot of challenges to address, but we have a successful foundation on which to build. And we've received very strong support from our new NHS host organisation, namely the University Hospitals of Liverpool Group. And I would like to welcome Dr. Jim Gardner, their Deputy Medical Director, to say some words.